Hi everyone, my name's Lauren. I'm a registered dietitian and I lead on the Best Food Forward project here at the School of Artisan Food. So this is a summary of the presentation that I did for the recent Health Inequalities Forum in Basset Law. So this is for anyone that wasn't able to attend to catch up. So what is Best Food Forward? Best Food Forward combines evidence-based knowledge about food, nutrition and health with hands-on cooking skills. So the aim is to support people in making lastingly healthier and more sustainable choices about how they eat. So together we try to explore the why and the how of eating well and what this means for healthcare professionals and medics working with their patients. So why is there a need? So it's well documented that nutrition training in medicine and in healthcare is inadequate. While there have been some real efforts to improve nutrition education within UK medical schools, a recent Lancet report indicated that current training is still insufficient and insufficient to provide high quality nutritional care. So the article that you can see on your screen here is Makinich et al. From 2020, and it found here that over 70% had less than 2 hours of nutrition teaching throughout their entire medical school education. And again, why is there a need? So amid ever-increasing diet-related diseases, an environmental crisis, and ongoing recovery post-COVID-19, it's more important than ever for medics and healthcare professionals to understand the role of diet in both human and in planetary health. So primary care workers and likewise public health teams, for many patients, they're the first point of contact for health-promoting information. So it's vital, therefore, that these professionals be equipped with sufficient nutrition information, and that's the sufficient information to engage with their patients on topics surrounding food, and then also recognising those opportunities for onward referrals to dietitians appropriately. From an environmental point of view, food is a significant contributor to climate change. It's currently estimated that around 15 to 30% of greenhouse gas emissions are deriving from the food system. So a shift in dietary patterns is required to meet this current net zero carbon emissions target and to support population health as well. So GPs and other health professionals working within the primary care, they're a vital, trusted stakeholder in bringing about this change. And more specifically, why is there a need locally? So we know that food is both a cause and an outcome of inequalities and deprivation. As you'll be aware of, there are pockets of high deprivation within Basset Law and surrounding areas. So the LSOA, which is pinned on the map, is among the 5% most deprived neighbourhoods in the country. So ensuring that our GPs and our healthcare professionals locally recognise and understand how these factors can impact dietary choice is really key. So the aims and objectives of Best Food Forward. The aim and objective one was to pilot a practical in-person food education session with healthcare workers. We wanted to determine the feasibility, the acceptability and the effectiveness of this alternative approach to food and nutrition education. The second objective was to survey locally, so a scoping survey to gain insight into current attitudes, knowledge, skills levels and concerns around food-related topics for healthcare professionals. And then thirdly, we wanted to understand better by identifying some of the barriers to action. So that's for those healthcare professionals that wanted to upskill in food and nutrition and health, but there were barriers in their way. So the scoping survey, again, was intended to explore current attitudes, knowledge, skills, levels of awareness around food-related topics in clinical practice. So there was a total of 36 people that responded to the survey, of which 33 were included into the analysis. And they were from a range of different professionals, including general practitioners, registered nurses, a midwife, a pharmacist, and some healthcare assistants in there too. So respondents were asked to quantify the number of teaching hours they'd received, and that was teaching hours focused on food, diet and nutrition throughout their professional training career. And as you can see from here, it quite nicely mirrors that of Makinich et al., which about 75% had received under the 8 hours here. So still a very minimal amount of nutritional training that these professionals had received. Respondents were then asked to provide additional comments on those hours of training that they've received. Responses included things like mostly self-taught with little official training, very little would like more, extremely little as a student in their career, and only because they've undertaken additional courses themselves. So very much it's not part of standard training at the moment. Respondents were then asked to also comment on the frequency that they were discussing food, diet and nutrition with their patients. So from the data, you can see that almost half of the clinicians were speaking to their patients nearly every day around food and diet. And then over 3/4 were actually speaking to their patients at least a few times a week. So we've got this combination of them having a very minimal amount of training, but actually they're very frequently talking around food, which is quite unsurprising, given that many of the NICE guidelines recommend that diet and lifestyle modification is part of the management and prevention of multiple conditions. So on the screen here, you can see we've got the NICE guideline for obesity, type 2 diabetes, cardiovascular disease, but also things like malnutrition, fertility, irritable bowel syndrome, and all of those things that are commonly seen within the primary care. Respondents were then asked to describe their self-perceived confidence in providing nutritional advice to their patients. So responses indicated a moderate self-perceived confidence, with an average rating of about 5 out of 10. And this was further justified by an average of around 8 out of 10 rating for wanting to learn more about how to discuss diet with their patients. And as you can see from this slide, this increases the potential risk of clinicians contributing to misinformation surrounding food. So concerningly, as shown from the word cloud below, there are potentially some non-credible sources of nutrition information that were being recommended to patients by clinicians. So particularly concerning is the reference to none, which was frequently put down in the responses, Google and internet, which obviously we know there is a high risk of misinformation with these sources. So what we've concluded from this scoping survey and the feedback from within it is that a course for upskilling healthcare professionals and medics in food is needed and it's wanted. So what did we do? We developed a programme to address this gap in the education, and that is Best Food Forward for medics and healthcare professionals. It's a day-long training session. It was delivered to a total of 44 participants from 2 major NHS organisations locally. They were from a range of professional bodies. So we had medical doctors, nurses, health professionals, health promotion professionals, speech and language therapists and dietitians attending the course. Best Food Forward overall looks at the whole food system. So we're looking at what we eat, why we eat it, how and where we get our food from, different cultural practices around food, the enjoyment of food, which is really key, and how it can affect our health and also the environment. So some of the key topics that we discuss: food and the impact on health, the environment, barriers to food accessibility, a realistic approach to eating well, the practical food skills, and we get with the hands-on element of the programme, influences of advertising, we cover behaviour change theory, and we also cover understanding the different roles within the healthcare system to support that healthy eating. So as mentioned earlier, we know that inequalities, including inequalities around food education, financial insecurity, food availability and food prices, they all have an impact on food choice. So this is why the whole of Best Food Forward focuses on accessible food options, so those food options that can actually be incorporated into the community. So we use ingredients from the FareShare network. So those were reflective of the food that was available in the food hubs at that period in time. And we wanted that to give a real life indication of what foods that these clinicians' patients might actually have available to them to cook with. So their task was to make do with what they had available and still make a healthy, balanced and delicious meal based on the case study that they were given. And it's really important that we highlighted the impact of the inequalities and explored what you can see on your screen now, which is the broader determinants of food choice. So the individual is actually considered when providing that dietary advice. It's all very well reading a very credible article which demonstrates how a low carbohydrate Mediterranean diet improves a patient's HbA1c. But if your patient has minimal food education, their social norms are to eat takeaways, they have no time to prepare daily meals, minimal income, they're geographically living in what's referred to as a food swamp, there's high fat, salt, sugar advertising bombarded them. By providing them that advice, it actually risks widening that health gap because they haven't got the infrastructure around them to be able to actually enact that recommendation that you're making. So we take some of these quite complex theories and we teach them in a really fun and interactive way. We use case studies to bring a real-life clinical application aspect to the sessions. They are a combination of theory and practical sessions to create this enjoyable but yet informative session. But we wanted to make sure that they were actually effective in bringing about some of the improvement in skills and knowledge. So following the session, there was a significant difference in the confidence in health promoting behaviour, including improvements in self-perceived confidence in planning and preparing a healthy and well-balanced meal. Fundamental nutrition knowledge improved by 66%, and there was also a self-perceived confidence in motivating behaviour change that had improved by 54%. And we noted that there was an improvement compared to the scoping survey of the knowledge and awareness of credible sources of information. And that was really interesting because there were things on there like the NHS food scanner, reference to the British Dietetic Association and their food fact sheets, knowledge of local food banks, the British Nutrition Foundation, One Blue Dot, which is the British Dietetic Association's recommendations for clinicians around sustainable diets, and generally some broad concepts, so things like the cultural Eat Well guide, so a lot of an ability to impart some of that diverse eating practice. And some more of the outcomes. So this was some of the feedback. It made me feel enthused and empowered to go away and make the change in my practice. Some more enthusiasm, so they're having more holistic conversations with their patients. They came away feeling enthused. And this last one's really important, and it links to some of the feedback from earlier. So it's important to you and not just your patients. And I think that's really key because what we're actually trying to do here is also support the health of the clinician themselves. So going back to some of the outcomes earlier, if they actually had more of confidence in planning and making healthy and balanced diets, that's also going to be important for their own health as well. And so we're at the end of it. Obviously, this is a recording, so you can't ask any questions. But that, in a nutshell, is what Best Food Forward is doing to educate healthcare and medical professionals on food and health, and how we're trying to create this improved awareness of health inequalities related to diet, and how we can use those, the increased knowledge around those, and adopt them in a clinical setting. So I will leave my contact details underneath the slides, underneath the recording. So if you have any questions, do feel free to get in contact. We'd love to hear them. You can either contact us through the School of Artisan Food website as well, or we have our own Best Food Forward website, which is bestfoodforward.co.uk. Thanks so much for listening.